Hello everyone, welcome back to our channel. This is a continuation video of the video series that I am doing in preparation for your board exam on November 11 and 12. The next topic is still part of the DOH programs. We are going to talk about the child health programs. The child health programs is a cluster of programs that is designed to address problems or concerns for children ages 0 to 9 years old. Basically, we want to decrease the morbidity and mortality among this age group to answer Millennium Developmental Goal number 4 or reduce child mortality. So Child Health Program is based on Republic Act 7610 or the Anti-Child Abuse Law. Do not be mistaken, 7610 po is Anti-Child Abuse Law, 7160 is your devolution code of the Philippines or the local government code. Now, pag sinabi natin Child Health Program, as I mentioned, is a cluster of health programs. Available ang mga programs na ito sa health facilities including infant and young child feeding, newborn screening, API, management of childhood illnesses, micronutrient supplementation, dental health, early childhood development, and child health injuries. Let us discuss and have the key messages under your infant and young child feeding. Infant young child feeding is designed to reduce child mortality by 2/3, especially for infants. Okay, this is by emphasizing the importance of your breastfeeding. Now, the key messages of this program is that we need to initiate breastfeeding within the first hour of life. Okay? So within first hour of life, kailangan mag-start na pong magsuso yung baby sa nanay para makuha nyo na rin po yung kanyang colostrum. And of course, this colostrum contains now immunoglobulins, specifically your IgA. Another one is that exclusive breastfeeding should be promoted for the first 6 months. No vitamins, no water, and no other foods should be taken or ingested by the baby aside from the breast milk. On 6 months and 1 day, we could start the complementary feeding, which is the offering of the solid foods, okay, to the baby, and we can offer whatever food is available at home. Kung anong ulam natin, yun din ang papaulam natin sa kanila. For as long as na-blend siya ng maayos. Another one is you can extend breastfeeding up to 2 years and beyond. Okay, another program is your newborn screening. So newborn screening is based on Republic Act 9288, also known as the Newborn Screening Act of 2004. So yung Newborn Screening Act of 2004, wherein newborn screening is a congenital metabolic disorder that is designed to detect metabolic disorder that could either kill the baby or make them develop mental conditions. Okay, so newborn screening is designed to develop and ideally done 48 hours, but it can be done on the 25th hour after birth. But if you're going to choose between 24 and 48, the best answer pa rin po si 48 because these conditions are metabolic disorders, meaning they develop after ingesting the food. Okay, newborn screening act. Next is, what is the goal of your newborn screening? To reduce preventable deaths of all Filipino newborns due to more common and rare congenital conditions that can be screened through your newborn screening. So how is it done? Okay, how is it done? So newborn screening is done through heel prick method. So in an absorbent paper, tutusok po tayo sa kanilang heel at yung dugo na yon ilalagay natin sa absorbent paper. It should be dried for 4 hours before it will be sent to the screening center sa inyong area. Okay? So other key messages under your newborn screening is that the results will come out 7 working to 30 days. Okay? Or 7 working to 3 weeks. 7 working days to 3 weeks as much as possible. The earlier the better, especially if the child has a positive condition. Negative result means normal. A positive result needs to be recalled the patient, okay, for confirmatory testing. So the nurse, the coordinator of the newborn screening program should contact the family if nag-positive ang result. It is done by a physician, a nurse, or a midwife, or a medical technologist for as long as they are trained. And it is done in all institutions like hospital, lying-ins, rural health units, and health centers. What are the disorders na na-screen? This includes congenital hypothyroidism, congenital adrenal hyperplasia, galactosemia, phenylketonuria, G6PD, and your maple syrup urine disease. Among the six, G6PD is the most common. So these are the screen disorders. Let us continue. Another program that is under your DOH program is the expanded program on immunization. Expanded program on immunization was already updated. It is now called the National Immunization Program. So let's go ahead and find out kung paano siya po nag-update. First is that, pag sinabi natin expanded program immunization program, okay, the basic concept is that EPI is under the Presidential Decree 996, which is the old law. The new law is Republic Act 10152 or 10152, which is the National Immunization Program. The target are the children less than 5 years of age. Okay, so other one is that the cold chain management. For the cold chain management, it is done to preserve the potency of the vaccines. So basically, we will going to put the vaccines into the refrigerator depending now on this type of vaccine, if it's a most sensitive to heat vaccine or least sensitive to heat vaccine. There are only two most sensitive to heat vaccines. We have your measles and your OPV, which is placed in the freezer with a temperature of ranging negative 15 to negative 25 degrees Celsius. While for least sensitive to heat naman, the temperature is positive 2 to positive 8, which is in the body of the refrigerator, and the rest of the vaccines will be placed under the body of the ref. That is the cold chain management. Another one is the vaccine storage. So from the regional offices down to barangay health station, gaano nga ba katagal dapat na dispose natin ng mga bakuna? For the regional offices, it needs to be dispersed within 6 months. For the provincial health offices, it has to be 3 months. 1 month for the health center or the rural health unit, and only 5 days when you use your transport box, okay? Or yung may mga cold dog, yung binadala natin sa community na parang ice candy. Okay? Lagayan ng ice candy. Another important concepts in your immunization is your FIFO and FEFO concept. The FIFO concept and the FEFO concept means first in, first out, or first expiry, first out concept. Okay? So the vaccines that are taken out in the health center but not used should be marked with X. And take note, we need to check the temperature of the freezer twice a day. This is upon entering in the community health center and before leaving the barangay health station or the community health center. So that is the concept of your FIFO and FEFO in your vaccination. Other one is your considerations. For the considerations, do not give it to children who, okay, has severe conditions, immunosuppressant, and had convulsions from the last dose. And give it to children naman na may mild to moderate conditions like diarrhea, fever, cough, and vomiting. So, pwede pong ibigay basta hindi po severe yung kanilang condition. It is safe to give all the vaccines at once at different sites. Do not restart schedule. You can give the vaccines later, okay, the date, okay, that they need to come back, but you cannot give it earlier. So you have to follow the minimum interval. If the minimum interval is 4 weeks, you have to follow the minimum interval. You can go beyond, but you cannot go earlier than the date. Okay, 1 syringe per 1 vaccine per 1 children policy, and 2 doses of MMR after 1 year old to consider the child as fully immunized child. Other concepts, immunization activities, meron tayong vaccinating the patient. So number 1, meron tayong BCG, Bacillus calmette guerin. The dosage is 0.05 injected intradermal on lethal area at birth. Hepatitis B is also be given at birth, 0.5 IM on vastus lateralis muscle at birth. Penta is 0.5 IM vastus lateralis at 6 weeks. 3 doses with 4 weeks interval. Same thing with your PCV and your OPV. The only difference is that OPV is given oral 2 to 3 drops. By the way, Penta is a 5-in-1 vaccine, includes diphtheria, tetanus, pertussis, hepatitis B, and your Haemophilus influenza bacteria, which is the main cause or common cause of pneumonia among 6 months old children below. Okay, PCV is your PCV13 pneumococcal vaccine. This is a vaccine that can protect a child from 13 strains of bacteria causing pneumonia. OPV is also given with the same interval, but is given via different route, which is oral 2 to 3 drops. On the last dose of OPV, pasasabayan po natin siya ng inactivated polio vaccine, which is given 0.5 ml intramuscular vastus lateralis, 2 doses. First dose is given during the last dose of OPV. The last dose or the second dose is given at 9 months, which is together with the first dose of MMR. Which will bring us to the last vaccines in the community as part of the National Immunization Program, which is your MMR, measles, mumps, rubella vaccine, given 0.5 ml subcutaneous on deltoid area. I'm sorry, it's not vastus lateralis, it's deltoid area. 2 doses at 9 months and 12 months. So that is the immunization activities for each of these vaccines to be given to children less than 1 year old. So at 1 year old po, dapat na kuha na nila lahat ng bakuna. Okay. Next po is the nutrition program. For the nutrition program, ladies and gentlemen, okay, this is to improve the quality of life of Filipinos through better nutrition, improve health, and increase productivity. Covered po nito lahat ng age group. Okay? Lahat ng age group. So, the Presidential Decree 491 of 1974, creating now the National Nutrition Council and for other purposes under the DOH guidelines. So, the key concepts of nutrition program, micronutrient supplementation is done, especially in children, giving vitamin A during the Araw ng Sangkap Pinoy, or known as the Garantisadong Pambata or the Child Health Week, providing supplemental vitamins to children 6 months to 71 months old or preschoolers. Okay? So, ito po yung ginagawa natin kaya nagkaroon tayo ng pinatawag na Sangkap Pinoy Seal Program. Okay? This is given or conducted during April to October, and fluoride by water and toothpaste is also given as part of the program. For the vitamin A supplementation for the following age group, pregnant women will receive 10,000 international unit during the second trimester or on the 4th month of pregnancy. Postpartum patient will receive 200,000. Children to 6 months to 11 months will receive 100,000. And child above 12 months will receive 200,000 international unit. Concept, minimum 6 months interval for each doses except if the child has measles. Meaning, if the child has measles and the minimum interval is 6 months, but if the child has measles and the last dose was less than 6 months ago, you could still give an additional dose depending on the age, kung gaano kalaki ang doses. If it's 100,000 or 200,000. So pag above 12 months, you give 200,000 additional, but if it's below 12 months, 100,000. By the way, you can start giving vitamin A to children at age of 6 months, never during the first 6 months. Proceed tayo. Iron and ferrous sulfate to prevent iron deficiency anemia and neural tube defect in unborn child during pregnancy. You have to take it with vitamin C or fruit juices to increase absorption. Avoid taking it with milk, and it may lead to black-colored stool. That's why you need to inform the patient. And iodine supplementation naman po, target population is women of reproductive age, 15 to 45 or 49, children of school age, adult males, and the preparation should be given iodized oil capsule, 200 milligram once a year only po. Once a year only. So that is your that is your nutrition program. These are the laws that affects the child nutrition. Please take note of this. Possible po na lumabas ang batas sa board exam. EO 51, your milk code. 7600 naman po for rooming in and breastfeeding act. Amended law is 128, extended breastfeeding law. 11148, kalusugan and nutrisyon ng magnanay act. And the Republic Act 8172 or your ASIN law or the salt iodization law. These are the laws that are affecting the child nutrition and you have to take note of this. Okay? Pag lumabas po pala sa board exam, si 7600 and 10028 at breastfeeding ang usapan, mas best answer pa rin si 10028. Okay. So